Yeah, I always like to start these discussions by just like definitions and just making sure that we're all on the same page because I have found that even in the medical and healthcare community, people often confuse equity with equality. So the working definition that I tend to use in terms of health equity is making sure that everyone has what they need in order to achieve their best health or their optimal health. And it's important that we define that because, particularly in our country, Matt, there's this idea around equality and this false perception that everybody gets the same thing and everybody has the same level playing field. And that's certainly not true. And so when we have conversations about health equity, we really have to ground them in an underlying belief and understanding that there are some populations in our country, whether it be race and ethnicity, whether it be based on their socioeconomic status, where they live, um, many other identities that in fact make you less likely to be able to achieve good health outcomes. So with that in mind, when we think about family caregivers and I reflect on my own personal experiences caring for my late father with my older sisters and the experiences of many others who have an identity that makes you marginalized, whether again it's your race, ethnicity, your sexual orientation, gender identity, your socioeconomic status. Caregiving is hard for everyone, like literally everyone. I'm sure that your clients, your audience knows that. And so if you can imagine that as difficult as caregiving is across the board, when you are part of a group that historically has been excluded and that is subject to bias, discrimination, racism, those barriers that every family caregiver faces become even greater. And in some cases, insurmountable. So I guess I'll just kind of start with there. I know we're going to go a little bit deeper, but I just like to kind of paint that picture because often people will say, well, I'm not this, I'm not Black, I'm not Latino, I'm not gay, and I care for my mother, and it's hard. And yes, like it's hard for everyone,
Hmm.
but it's even more difficult when you're facing all of these additional barriers.